Alright, let's dive into a common running ailment: runner's knee. This information is pulled straight from Tim Noakes' Lore of Running, a true Bible for runners. Specifically, this comes from Chapter 14, Diagnosis and Treatment of Running Injuries, in this 18-chapter deep dive into all things running. So what exactly is runner's knee? Or, as it's also known, Peripatellar Pain Syndrome. Well, Dr. George Sheehan identified it back in the early 70s. It's not just a general knee pain, it's got some very specific characteristics. You'll feel pain around your kneecap. It starts during running, not from a direct hit, and it tends to come on after a certain distance. It gets worse over time, especially during long races. Going up or down stairs, squatting, sitting for a while with your knees bent, all painful. And, interestingly, those cortisone shots, they usually don't provide a long-term fix. Now, here's where it gets interesting. Initially, it was thought this pain came from cartilage damage behind the kneecap, a condition called Chondromalacia patella. But that's not quite right. Dr. Stan James, and others, pointed out that the real pain is at the edges of the kneecap, where the tendons connect. This led to terms like Peripatellar Pain Syndrome and Patellofemoral Pain Syndrome. And research confirms this. It's the tendons and even the bone that are affected, not just the cartilage. You can even test for it yourself, or have someone test for it, by applying pressure to the edge of the kneecap. If it reproduces the pain you feel when running, that's a strong sign. The biggest culprit? Excessive ankle pronation. Basically, your foot rolls inward too much, creating a twisting force on the knee. This pulls the kneecap out of alignment, stressing the ligaments. Over time, this leads to pain. But it's not just about your feet. Other factors play a role too. Your shoes matter. Soft shoes that don't control pronation can make things worse. Training errors, like pushing too hard too soon or always running on a slanted road, can also contribute. And yes, genetics play a role. If you have hypermobile feet or certain bone structures, you're more prone to it. So how do you treat it? The key is addressing that biomechanical issue, the pronation. Proper shoes are crucial. You want shoes with firm midsoles, rigid heel counters, and good resistance to torque. If shoes alone don't cut it, custom orthotics are the next step. They help control that excessive pronation. And remember, simple first aid helps too. Ice, twice a day for 20 minutes, and over-the-counter pain relievers can provide relief. But avoid cortisone injections. They won't target the right spot. Now, if you're not seeing improvement within a month, it's time to reassess your shoes and orthotics. You might need a more aggressive approach to controlling that pronation. Remember, listen to your body, and don't hesitate to seek professional advice. Getting the right diagnosis and treatment is essential for getting you back to running pain-free.